Assalamu alaikum. So now we are going to study about brachial plexus, one of the important we can say a question that usually used to appear in first year MBBS or important landmark for specific type of anatomical disease, we can say. Or we can say that whenever injury occurs over the superior side of the neck, either in a RTA or road traffic accident, this plexus is usually observed in order to check any type of nerve injury. So the brachial plexus is usually formed by the union of anterior rami of C5. So I'm actually going to highlighted the portion of the brachial plexus with a pointer. So the brachial plexus is formed by the union of the C5, C6, C7, C8 and T1. Uh, these are called as roots of the brachial plexus. The roots of the brachial plexus passes through the between anterior and middle scalene muscle and give ganglion that passes through the white ramus trunk. But it's not our side to study. It's actually in second year of MBBS that deals with the neuroscience. Uh, so the roots of the brachial plexus unite together to form the trunk. That is uh, C5 and C6. These roots unite together to form the superior trunk. It's a superior trunk that is formed by the union of C5 and C6. Middle trunk, which is a continuation of C7, and the inferior trunk is formed by the union of C8 and T1. So it's a superior trunk, medial trunk, and the inferior trunk. The trunks of the brachial plexus then passes through the infraclavicle or inferior to the clavicle and form divided into anterior and posterior division. Anterior division supply the flexor compartment and the posterior division supply the extensor compartment. Anterior division of the superior and middle trunk, that is C5, C6 and the C7, unite together to form the lateral. To form anterior division of the C5, C6 and the C7 unite together to form the lateral cord. That is, uh, first of all we have roots, afterwards we have trunks, afterwards trunks we have cords. That is that the anterior division of the superior and the middle trunk unite together to form the lateral cord, and the anterior division of the inferior trunk unite together to form the medial cord, and that's the medial cord. Now posterior division of all three trunks, superior, middle and inferior, unite together to form the posterior cord that is responsible to supply the extensor compartment. So this is a brachial plexus simple concept. First of all we have the roots, afterward roots they unite together to form the trunk C5, C6, C7, C8 and T1. C5 and C6 unite together to form the superior trunk, C7 gives a middle trunk and the C8 and T1 gives inferior trunk. Then anterior division of the superior and middle trunk unite together to form the lateral cord, and the anterior division of inferior trunk unite together to form the posterior cord, and the posterior division of all three trunks unite together to form posterior cord बन जाता है. Lateral cord, medial cord, posterior cord. Afterward chords we have their specific nerve supply or different nerve. We'll deal it with separately on another lecture video.